Sarah, and I'm a first-year DPT student at the University of Central Florida, and today I'm going to be doing some ultrasound treatment on my patient, Ashley. She is 2 weeks post a surgical repair of her left Achilles tendon, so we're going to be doing some pulsed ultrasound in order to facilitate the tendon healing. So the first thing I'm going to do is I'm going to make sure she doesn't have any contraindications that would deter me from doing ultrasound. So do you have any active malignancies that you know of?
Nope.
Do you have any joint replacement in your ankle area?
Nope.
Okay. Do you have any blood clots that you know of?
No.
Okay. I know that because I'm only doing pulse, I'm not going to disrupt any inflammatory phase of healing that she might be in. She's old enough to not have any epiphyseal plate issues, and she doesn't have any fractures in her ankle. So the reason that we're doing ultrasound is to facilitate the tendon healing, which is going to happen because it's going to increase the cell permeability in the area. So what's going to happen is I'm going to have you lay down on your stomach. I'm going to be moving the transducer, which is the instrument, over the back of your tendon. You shouldn't feel anything from the treatment. If you feel any pain or any numbness, tingling, any weird sensation, just let me know and we'll go ahead and stop. Is that okay?
Okay.
So I've positioned my patient in prone, which I made sure was a comfortable position for her so that I would have full access to her Achilles tendon area. So right now what I'm going to do is I'm going to go ahead and check her skin sensation to make sure that she is okay for treatment. So what I'm going to have you do is I want you to close your eyes, I'm going to touch your skin, and I want you to say when you feel it.
No. 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 No.
Okay. So she has good sensation in her skin. So the next thing I'm going to do is I'm going to go ahead and clean the back of her heel and the transducer head with some alcohol to make sure that we're not spreading any infection. And the transducer head size that I've chosen is one of the smaller ones since her treatment area is a narrow area of her body. And so now we're going to get her set up for treatment. So the parameters that I have chosen is a 3.3 megahertz frequency because it is a superficial area we're treating. It's a 20% duty cycle because we don't want to have any thermal effects. And I have chosen an intensity of 0.5 watts per centimeter, which is appropriate with the 3.3 megahertz. I've also turned the head warming off so that we don't have that become a warming effect because I want to make sure that we're not heating her tissue, and I've chosen an 8-minute treatment time. Now that we've prepped the area for the treatment, I'm going to go ahead and apply the gel to the ultrasound transducer head. So I'm going to make sure that the gel tip doesn't touch the actual head of the machine. And then I'm going to apply the transducer to the area and hit start. And I'm going to make sure that I'm moving the transducer head at all times and maintaining contact with the area. Ashley, I want you to let me know if you feel any warmth or any discomfort.
Okay.
And I'm just going to maintain movement all over the belly of the tendon. So now that the treatment is over, I've stopped the machine. I'm going to take the transducer head off. I'm going to go ahead and clean the head of the transducer and clean my patient's leg. I'm going to look at her skin and make sure that there's no redness or any adverse reaction going on to the gel. And so she did not experience any feelings of heat, which is good because we weren't going for a thermal effect. We were going for the tissue healing effects of ultrasound. And this is because of the increased cell permeability. She will probably eventually have some pain reduction from this treatment as her tissue begins to heal and moves into the proliferative phase. And so we would continue with this treatment for the next several therapy sessions.